Welcome, everyone. Good morning. Ms. Howell, how are you doing?
Good morning.
Welcome to the Joint Legislative Audit Committee's first hearing of the 2011-2012 legislative session. I'm strongly encouraging all committee members to attend the hearing as soon as possible so quorum can be established and the hearing can commence. Secretary, please call the roll.
Laura.
Here.
Laura here. Alejo.
Here.
Alejo here. Donnelly. Here. Donnelly here. Huber. Monning. Here. Monning here. Norby. Wagner. Alquist. Anderson. De Leon. Dutton. LaMalfa. Rubio. Rubio here. Wolk.
Okay, absent JLAC members, we need, if they can please report to 126 so that we can start our hearing promptly. Mr. Rubio, do you want to call? Let's call your colleagues. That would be great. Just waiting on a few senators so that we can adopt the rules and elect the chair. Senator De Leon. Welcome, Senator De Leon. Appreciate.
Good morning, Mr. Chair. It's an honor and pleasure to be here. I must say that just 3 or 4 months ago, if I'm correct, and if I can stand corrected, you were working for me. And now you're Mr. Chair. So what's wrong with this picture going around?
You know how to pick them.
Let me say that, Mr. Chair, I do. Just want to say that I'm very, very, very proud of you, you being this chair of this committee. Obviously, there's a lot to do in the state of California, especially in today's economic climate, where we have to bring a lot of transparency to government, and particularly to state, local government. So I know that you're going to do an exceptional job. You're in a very keen position right now, given what's taking place, especially in your backyard with Bell and other municipalities that are very similar throughout the state. So I just want to congratulate you, Mr. Chair, and I look forward to serving with you.
Thank you, Senator. Appreciate it. Appreciate your kind comments. Just waiting for one more senator and we can rock and roll.
Yeah. She's working for the AG now.
Senator Keo, we're just waiting on one more senator, fortunately. To join. Secretary, please call the absent members.
Norby, Alquist, Anderson, Wolk. No, Dutton's here. Oh, Dutton. Here.
Okay, we have quorum. Before the committee can begin and consider new audit request, we need to take care of some housekeeping items. First, we must elect a new chair of the committee, and Mr. Speaker has appointed me to serve as chair. It takes a majority of the committee. Is there a motion?
Motion.
Second.
There's a motion and a second. Secretary, please call the roll.
Laura,
Yes.
Laura I. Alejo,
Aye.
Alejo I. Donnelly, Donnelly I. Huber,
Aye.
Huber I. Monning, Monning I. Norby, Wagner, Wagner I. Alquist, Anderson, De Leon,
No. Excuse me.
De Leon I.
I saw your
Dutton.
staff, remember.
Dutton I. Lamalfa, Lamalfa I. Rubio, Rubio I. Yes.
Senator, we need you, Senator Amalfa, we need you for one more quick vote. So thank you so much, members. I appreciate it. I look forward to serving with you as chair. Now we need to adopt the committee rules for the 2011-2012 session.
Move
A
to
copy
adopt
of the
the
rules
rules.
can be found. There's a motion. Is there a second? Second. Secretary, please call the roll.
Laura,
Aye.
Laura I. Alejo,
Aye.
Alejo I. Donnelly, Donnelly I. Huber,
Aye.
Huber I. Monning, Monning I. Norby, Norby I. Wagner, Wagner I. Alquist, Anderson, De Leon, De Leon I. Dutton, Dutton I. Lamalfa, Lamalfa I. Rubio, Rubio I. Wolk.
That's a pass, so we are ready to start our business. Also, I need to note, item 2011-105 by Senator Padilla has been pulled from today's agenda. And finally, Senator Smythe cannot be here today, so Senator Wagner has been appointed as his replacement for this hearing only. And before we move forward on today's business, I would like to take a moment to also welcome our new and returning committee members. Like I said before, I look forward to working with you. And for today's hearing, audit requesters will be given 3 minutes to present, followed by the state auditor. Representatives from the affected agencies will be given 2 minutes. Public comment will also be limited. For the first two people to speak will be given 1 minute each, and everyone else can only state their name and their position on each audit. Thank you in advance for your cooperation. We move now to our regular business and welcome our esteemed state auditor, Ms. Elaine Howell. Ms. Howell will provide the committee with information on the Bureau of State Audit status report and work in progress. Thank you, Ms. Howell.
Thank you, Mr. Chair and members. For the record, my name is Elaine Howell. I'm the California State Auditor. And currently we have 15 audits in progress. 4 of those audits are statutory audits. 2 large ones are the audit of the state's financial statements and what we call the federal compliance work. We look at federal programs for which California receives significant amount of money, including the stimulus money. So we're in the process of completing those 2 audits, which use a significant amount of our resources. Those will be released publicly in March next month. We have 11 JLAC audits in progress. These are audits that were approved by the Audit Committee last year, and these audits will be released over the course of the next several months, freeing up resources. As the Chair indicated, there are 4 requests before the committee today. We have resources available over the course of the next couple of months. Between March and April, we would be able to start 5 audits. So we do have the resources to commence work on these audits if they are approved. We would be able to start 2 of those audits in March, and then the remaining 2, given the committee approves all 4, the remaining 2 in April. But as I indicated, based on the flow of work, we'll be releasing additional audits in March, April, May, June, freeing up resources for future audits as this committee convenes in the future. With that, I'm available to answer any questions members have about status or the work we currently have underway.
Is there any questions for the state auditor? Great, thank you so much. We are, oh, sorry, Mr. Wagner.
Apologies, I meant to jump in. Just a real quick question with respect to the resources available. We've had a chance to pull the audits that were done over the last 2 years or so, and it appears to me that in general these all cost $100,000, a little bit more. Address maybe if there's an overarching reason why, and let me have, please, a little bit of confidence that, if something comes up later in the year, you'll have the resources to deal with it at that point. Thank you, Mr. Chairman.
Certainly, good question, Mr. Wagner. These audits, all of them, as you indicated, are a little bit more expensive than an average audit. Typically, an audit is around 2,500 hours. Each of these are at least 3,000 hours, or there's one that's actually 4,000 hours. The reason these audits are a bit more expensive than typical audits is because of the number of locations that we have to visit for each of these audits. And I can touch on it as I go through each, but for example, the mutual aid audit, the requester is asking us to go to a sample of regions within the state of California, and then within those regions visit jurisdictions that have responded to emergencies. So we will have to visit local regions and then go down to perhaps individual counties or cities that respond to emergencies, in addition to conducting work at the state level at CalEMA. Other audits have similar types of requirements as far as the number of entities that we will have to visit. Most of these audits also are going to require us to go out to the local level, which again drives up the costs a little bit.
Thanks so much. Any other questions for the state auditor? Great. We'll go ahead and begin our hearing. We'll begin with Senator Kehoe and sign in order. Ms. Kehoe, welcome.
Thank you, Mr. Chairman.
Morning.
The item number is 2011-103. Folks.
Good morning.
Members, it's tab B on your folder, on your binder. Senator, go ahead.
Thank you. Good morning, Mr. Chairman and members. I appreciate you hearing my request for this important audit. I would like your support to have the state auditor conduct an audit of California's entire mutual aid system. Our mutual aid system, which was established in the 1950s, is the foundation upon which California's overall emergency management response rests, and it has become a model for the country of the United States. In the last 2 years, however, as state and local budgets have been slashed, so has mutual aid response. As chair of the Joint Legislative Committee on Emergency Management last year, during the last session, we heard testimony at a hearing in San Diego in 2009 where emergency management professionals, firefighters, and others expressed concern for the mutual aid system, specifically regarding fire issues. In fact, the immediate past fire chief in the city of San Diego, my home city, testified that she could no longer send the same number of trucks, same number of strike teams to assist other jurisdictions under mutual aid, and still have sufficient resources to protect our city, San Diego. You might note also in Saturday's paper in Reading, a newspaper article highlighted cuts raise alarm for firefighters. North state agencies rely on mutual aid. Reading last year provided mutual aid 47 times and received it 18 times. That's the kind of imbalance that alarms local communities. And members, even though it's maybe counterintuitive, almost all communities feel like they're getting the short end of the stick. So we need to look at this and figure out how we're going to support our, what exactly our mutual aid system consists of now, the stresses and strains it's facing, and then we as policymakers can respond. San Diego's not alone with the problem, as I just explained to you. Hearings in Sacramento on California's mutual aid system last year. Again, we heard from emergency professionals a number of concerns that raised alarms with the members of the committee. Former CalEMA Secretary Matt Bettenhausen testified that the current financial situation has resulted in staffing reductions, program cutbacks, elimination of programs, and blackout and brownouts of local firehouses. He said that while local governments are doing the best they can, they may no longer have the resources they need to respond to mutual aid requests as they have in the past. There's also a problem with delayed reimbursements to local government from the state and the federal levels. All in all, enough concerns were raised to prompt me to ask for your support in analyzing and auditing the mutual aid system. There are some new issues that are coming to our California emergency management response. Governor Brown has proposed that fire engine staffing be reduced from 3 to 4 firefighters. He's also proposed a state budget savings of up to $250 million achieved by reclassifying state responsibility areas for fire protection in rural parts of California, including San Diego County. That would shift costs to local communities. This audit will provide a much-needed, up-to-date assessment on the health of our mutual aid system so that we can make informed decisions. I'm delighted to have some supporters here. Mike Dayton, Acting Secretary of CalEMA, I appreciate. Ralph Heim, representing fire chiefs. Thank you for being here. Members, I want to acknowledge this is an expensive audit, but the scope of this audit is necessary. If we don't look at the whole system, it's pointless. Mutual aid is a network. It's a fabric that goes from the Oregon border to our border with Mexico. You cannot piecemeal it. It's municipalities, it's state government, it's the National Guard, it's federal government. So it really needs a good, solid look. I ask for your support.
Thank you, Senator. And just so the members know the process, we'll have the state auditor response to the request, and then we'll have folks from the affected agencies, and then we'll take questions from our members. State auditor, please.
Thank you, Mr. Chair. As Senator Kehoe indicated, this would be an overall audit of the mutual aid system. The first place we would start, as I was explaining to Mr. Wagner, I picked mutual aid, coincidence, that we would start and look at CalEMA and their structure that they have set up. There are various systems. As Senator Kehoe indicated, California's system has been a model for other states in the United States. It's a nationally recognized model. We've audited it in the past. It's been several years since we've conducted an audit, but we'll certainly try to leverage some of the experience that we have from previous audits. But start out at the state level, at CalEMET. What kind of processes do they have in place for managing the mutual aid system, their costs, how do they capture costs, track information, et cetera. But then really get down to the local level and go out to a sample of these regions. There are 6 mutual aid regions in California, and then within those regions, certainly there are the jurisdictions. What Senator Kehoe has asked us to do is within those regions, a sample of those 6 regions, select some disasters that have occurred, not just state and federal, certainly state and federal disasters, but also perhaps disasters that didn't rise to that level and that may have occurred more at the local level where local jurisdictions are assisting one another and the state didn't get involved. So there'll be a mix of disasters that we're going to have to look at. And when we sample those disasters, what Senator Kehoe has asked us to do is assess the local jurisdictions process in place for funding, tracking costs, tracking what they've asked for as far as reimbursement related to the services that they have provided. In addition, at those entities, determine what costs they've incurred, both those that have been reimbursed and those that have not been reimbursed, so to be able to categorize those. And then looking at the reimbursements, how long is it taking for these entities to be reimbursed for the services that they've provided? Also, based on the sample that we look at, determine if these some local jurisdictions are receiving more benefits than others. I think she's interested in seeing if there's a disproportionate occurrences out there where some jurisdictions are getting reimbursed more than perhaps others. Asking the local jurisdictions if they have done any type of analysis to evaluate the impact that responding to emergencies has had on their budgets and any budget cuts that they've incurred up to now, and then any anticipated budget cuts, what kind of adjustments do they believe they need to make so that we can provide that information to the legislature as well. And then the last step, to the extent we can, to try to compare the results from what we see in the regions that we do select. We say to the extent possible because we want to make sure when we look at some of these emergencies that we're comparing apples to apples, and we're not sure we'll be able to do that. We certainly will attempt to do that so we can have some comparative information. But again, that's the last objective that she's asked us to accomplish. This audit is a little over 4,000 hours. Again, as I was explaining in my earlier comments, the reason for that is we're looking at it from a global perspective at the state level, but certainly getting out to the local level and really understanding what our local jurisdictions are facing with regard to responding to emergencies in California. The audit will take approximately 7 to 8 months based on the amount of staff we can assign to the project.
Thank you so much. Now we'll hear from those folks from affected agencies and the public.
Good morning, Mr. Chair. I'm Mike Dayton. I'm the Acting Secretary of the California Emergency Management Agency. You know, we really appreciate the Senator's partnership and her interest in this issue. It's critically important to us. We've got about 6,000 engines in California that are part of the mutual aid system, and within 24 hours we can put 500 of those engines on an event. It'll take us another 12 hours to put an additional 500 engines. So the last thing in the world we want is a fire chief to be sitting back questioning the state's ability to reimburse them from deploying to a fire. I mean, our mutual aid system really relies on a quick response, and we don't want any hesitation in it. And in large measure, you know, the willingness of fire chiefs to deploy their folks is going to be our ability to quickly reimburse them. So we're willing to work with the auditor on this audit and to invest our own resources to make it, you know, as cost efficient as possible. So, you know, we think it's a good idea. We appreciate the interest, and we look forward to, you know, finding any efficiencies that there are. So thank you.
Mr. Chairman, members, Ralph Heim for the California Fire Chiefs Association, and also today representing the California Fire Districts Association. We support Senator Kehoe's request. The audit objectives that Ms. Howe has outlined, we think will provide you as decision makers the information we will need to keep what is, and we hope will continue to be, the best mutual aid system, not only in America, but we believe the world. Our partners with the agency, CAL FIRE, all of the local agencies view mutual aid as a top priority. We too have had to make cuts. Unfortunately, last year was the first time that most can remember that one agency, San Francisco, had to decline. They simply did not have the personnel. That is a very dangerous trend if it continues. We will make every effort to provide Ms. Howe with resources at the local level that perhaps can make her job and cost a little easier. We feel very, very strongly that this information is much needed so that we can make the right decisions as we go forward on mutual aid, and would respectfully request your support as well. Thank you.
Thank you. Anybody else from the public care to just briefly comment?
Yep, my name is Afrag Vargas. I'm with the California State Firefighters Association, and no need to repeat what Mr. Heim said so eloquently, so we support.
Great. Thank you. Now I'm going to take questions from the committee. Ms. Huber?
Thank you. I'd like to move the audit, and I just wanted to commend the author. I did serve on the Joint Emergency Management Committee, and I think a lot of red flags were raised about our mutual aid system, and I just wanted to commend you for taking this action, so thank you.
Thank you, Assembly Member.
Thank you. Mr. Alejo seconds. Secretary, please call the roll.
Laura,
Oh, Mr. Norby has a question. Sorry about that.
Mutual aid occurs among different agencies. If there's one great big agency and they have a lot of different fire stations, it's not called that. They just do mutual aid internally, and that's a whole different system, isn't it? And to the extent that we have a lot of different fire authorities, makes mutual aid more necessary. So I'm hoping that this audit will go in the direction of possibly recommending or looking at agency consolidations and where they might be helpful, which would reduce the need for mutual aid at all. Because we have, 480 cities in California, is that right? But four something. Out of those, I'm guessing maybe half have their own fire departments, maybe fewer. L.A. County has about 80 cities, half are L.A. County Fire. I know Orange County we've got maybe half are with the fire authority, and that trend is continuing. In my district, I'm just thinking out loud, Placentia, Yorba Linda are with the Orange County Fire Authority, which is the equivalent of our county fire department. Brea, Fullerton, Orange, Anaheim have city fire departments. La Habra goes with L.A. County Fire, even though they're in Orange County. And fire department consolidation is something that cities are looking at increasingly, and I'm hoping that this will encourage them to do so, and the more they do so, the less mutual aid becomes an issue. Is that accurate?
Go ahead, Mike. No, I'm just going to say, Mr. Norby, I don't know that consolidation for consolidation's sake will cause less need for mutual aid. Mutual aid will be there regardless of how many agencies there are. I think
but if there's a brush fire, say, in the foothills in L.A. County, and it's an L.A. County fire jurisdiction, they can draw engines from other county jurisdictions that may be far away, and it's not mutual aid because they're simply doing it internally, correct?
There's statewide mutual aid, and then there are agreements that various jurisdictions will make here in Sacramento, for example.
Is this only looking at the state mutual aid then, or is it looking at interjurisdictional mutual aid?
Mr. Norby, your question is so timely, and especially from someone from San Diego County. San Diego County doesn't have a county fire department. We have a network of fire departments in the backcountry, the rural areas, suburban areas, and, of course, in the cities, Oceanside, National City. Their mutual aid is any department helping out any other department. So it can be National City helping out in southeast San Diego. It can be Oceanside helping out in Camp Pendleton. Consolidation is an important related issue, but it's not the same as the overview that we need to get of mutual aid. Even if we just had one county fire department for each county, we would still need a mutual aid system.
Right, but it would be across county lines as opposed to within the county.
That's right, but there's within counties and across counties, and there's folks that come down from Del Norte to San Diego if the fire's big enough, which is extremely costly to the taxpayers. They come on their trucks, they drive them down the highway. So
now let me
Mr.
ask you
Vargas
about the
can talk
cost. I remember when I was on the Fullerton City Council, we sent fire trucks up to L.A. in '92 during the riot, and in an extreme case like that, my impression, because I asked how much we were getting reimbursed, we said, well, L.A. can't afford to reimburse us. We're doing it on a Good Samaritan basis. Is that the way it used to be done? Now there are direct costs involved. Is it still done that sometimes if there's a major issue, or does it depend on the situation? I remember during the OJ chase, you had half the police departments in Orange County chasing them all the way to Brentwood, and I'm sure they weren't charging LA County, but that's a police issue, different than fire. But in some cases, is it done still Good Samaritan?
Let's have the
is there an accounting
respond to that, yeah.
Sir, it really depends on the scale of the event, and if it's a larger scale, then the governor typically proclaims at least a state of emergency, and then that opens up the California Disaster Assistance Act, and then under that, the state is on the hook for 75% of the cost for the response cost. And then if we seek as a state a presidential major disaster declaration, then that puts FEMA on the hook for 75% of the cost. So, and then the local share actually goes down to 6.25%. So I think that's where some of the auditor will look at, the billing practice that we use for FEMA and how FEMA reimburses us. And then there's also a question of the response is on a state responsibility area or a federal responsibility area. Because in some events, your locals are helping out the U.S. Forest Service to contain a fire that could spread into a local responsibility area or a state responsibility area. So the reimbursement's actually from the Forest Service directly to the fire department. So I think the scope of this audit would encompass that, but our interest is really making sure that in any of those scenarios, the fire department gets reimbursed quickly.
So somebody does get reimbursed somehow. There's never a true Good Samaritan situation, or at least not anymore, or we're trying to get reimbursed as opposed to just writing it off.
Yeah,
I haven't heard of Good Samaritan, Mr. Norby. No. These protocols are established over decades, and there's lag time in reimbursements, but somebody somewhere at some point gets some of their money back.
Okay, some. Okay, thanks.
Okay. Next we have Mr. Amani.
Yeah, just real briefly, I want to thank the Senator for bringing this forward, and I think as you articulated, as we're facing constricted budgets, the proposed reduction of CAL firefighters per unit, the ability to be more efficient in the deployment and expedite reimbursement will become all the more critical. The region I represent, we've had massive fire incidents in the Big Sur Mountains and the Lockheed Martin fire, and it was amazing to see literally hundreds of units, thousands of firefighters from all over the state who deployed to Watsonville, and within 24 hours, Cal EMA and CAL FIRE set up base camp. There's a trailer just for the reimbursement that units from San Diego or wherever, but with limited budgets at the local level and constricted state budget, I think the efficiencies that this audit seeks are absolutely critical, and they're both financial efficiencies, but I think more importantly, it's response efficiency. And while fire has been used as the example, earthquake is a constant threat in this state, other natural disaster. So I think being proactive in trying to, and I guess my question would be to the auditor and the author, is it contemplated that part of the recommendations will be focused not just on financial efficiency, but indeed response and public safety efficiency? Is that one of the objectives that would be identified in the audit?
Certainly from a financial perspective, we would absolutely all of the objectives talk about it from a funding perspective. We certainly could look at some of the operational, looking at CalEMA and then understanding within each of the jurisdictions for those disasters that we sample, whether or not there could be efficiencies in the response.
And presumably there's a direct correlation, I would hope, between financial efficiency and subject response efficiency. But the problem is with shrinking budgets, we're going to have to work even harder to maintain current levels of participation, is what I'm hearing from our experts. Yeah.
Mr. Monning, we haven't specifically asked for a management audit, but I think the information that Ms. Howell brings back to us, first of all, will be shared with the legislature and the Joint Emergency Services Committee and allow us to start addressing those very issues that you're bringing up. Under tighter budgets, greater efficiencies are demanded, and we have to respond. It may be that we really can't continue to do business in the future the way we've done it in the past to a certain extent.
Right. Well, thank you. And this information through the audit will inform that future strategic planning, it sounds like. Great. Thank you, Senator. Thank you, Madam Auditor.
Senator LaMalfa.
Thank you. Senator Kehoe, thank you. It was brought up, the U.S. Forest Service, some of those federal lands that are involved sometimes in these in fires or other emergencies. I hope that would be part of the audit, too, to see that is there an element of that, looking at how the federal government does reimburse?
I'm going to have to ask the
I have a
auditor to respond.
12-county district, which you mentioned Del Norte, and
That's right.
many of those counties up there that there's a lot of overlap with federal lands and then state responsibility area, then local fire districts, and so it can get kind of complicated. And when there's a big one, you see up and down I-5, there's units coming from everywhere, San Francisco and all over the state.
Right.
And so sorting this out, especially if it was started out as a federal fire, federal land, then I wanted to see if that would be part of the element of this.
Senator LaMalfa, yes, there's an objective in the report that asks us about looking at reimbursements and whether it's the state or any other entity that's responsible for paying that reimbursement, how timely was what the amount was, and then how timely that reimbursement was made to the responders to get them reimbursed. So there is a specific objective in the audit request.
Okay, thank you. And again, up my area, there's a heavy volume of either CAL FIRE or local volunteers too. Are volunteers and their interaction and reimbursement part of this? The volunteers are part of this audit as well.
Yeah, I would think that would need to be included because it's encompassing any responders that are involved in a particular emergency in the regions that we select.
Okay, and will there be an element also of? Sometimes you might see even an over-deployment there. Will it be looking at the efficiencies involved with how many units would be appropriate for a particular area? Or, I mean, is there a way to look at it that way and find that past records would show that maybe there was an over-deployment simply because they maybe put out the alarm and send everything you can, and then you find that you have people coming from half the state away to
Senator LaMalfa,
maybe one of our panelists would like to jump in too.
I think, I wanted to have the experts respond, but in over-deployment would be very hard to assess in hindsight. I think they're going to tell you that the surge capacity and the immediate response is one of the most critical issues in fighting fires if they can keep them small. So we could look at that, or certainly have the emergency services, the Joint Committee, look at it. But I think that would be a really we'd have to take a very careful, thoughtful look at what over deployment, how that would be defined, and what would constitute over deployment. I don't know, Mr. Secretary, you have something to add?
Yeah, Senator, you're right that the initial attack is really our first order of priority in business, and over deployment, maybe we'll get to that issue on seeing a trend on what jurisdiction's been reimbursed most, but I'd be interested in trying to assess that. I'm just not sure how we go about doing that.
Yeah, just if you're able to see trends in that would indicate that, and I don't even know if it's being a huge problem or any kind of an issue at all, but it would be an interesting element, I think, as far as most efficient deployment there. Like if you have a big one going at one end of the state and maybe it's a little heavy there, and you're sorry you didn't have more of them down south again or something like that. But I would just be interested to see if that would be a condition that might come out of some of this other information we're going to find here. So
Thank you, Senator.
Thank you.
Thank you. Senator Rubio?
Senator LaMalfa touched on the issues that I wanted to address, and that was the reimbursement. So thank you, Senator, and thank you, Senator, for bringing this forward, and all the staff.
Thank you. So there is a motion and a second. Secretary, can you please call the roll?
Lara?
Aye.
Lara, aye. Alejo? Aye. Alejo, aye. Donnelly? Aye. Donnelly, aye. Huber? Aye. Huber, aye. Monning? Aye. Monning, aye. Norby? Aye. Norby, aye. Wagner? Aye. Wagner, aye. Alquist? Anderson? De Leon? Dutton? LaMalfa? LaMalfa, aye. Rubio? Aye. Rubio, aye. Wolk?
Measures on call, and we'll keep the roll open.
Thank you, Mr. Chairman. Thank you for
Senator.
your comments, members. Appreciate it.
Thank you. Now we're moving with the distinguished gentleman from Fresno, Mr. Perea. And that item number is 2011-101, tab A in your binder, members.
Well, thank you, Mr. Chair and members. I think I like being on that side of the dais better. Just want to thank you all for the opportunity to address you this morning and for hearing our request of this audit of CPS, of California Protective Services. All across California, there has been a growing disconcerting trend of child neglect, abuse, and in some cases death. A few examples from my district: Fresno County social workers are receiving a record number of calls reporting abuse and neglect. Our CPS workers have responded to a 15% increase in emergency referrals, which is 4 times the statewide average. Fresno caseloads exceed national standards. Additionally, in less than 3 years, 3 children in my district were beaten to death despite many missed opportunities to save them. And I'd just like to share one of those stories with you, and that is the story of a 10-year-old boy named Seth Ireland. Seth was beaten to death by his mother's boyfriend. Despite several abuse reports to CPS 5 months prior to his death and a visit by a caseworker the day of his death. This past Monday, his murderer and his mother were both sent to prison for his death. Unfortunately, stories like Seth's are not unique to my district. In an effort to prevent future tragedies, I would like to request the state auditor to review information related to cases of child neglect and abuse in California and identify areas of improvement. The sample size, we're looking at 4 of the largest counties by population in 4 regions: Northern, Bay Area, Central, and Southern. We selected this sample size primarily due to cost. We wanted to make sure that it was manageable and that we could actually get this information through, or get this information out. The information requested, we're looking for a couple of things. One, we're looking for DSS's role, policies, and procedures in preventing child abuse. We're looking for county CPS policies and procedures designed to protect children from abuse. Budgets of the 4 counties, including personnel and their caseloads, and if the counties have measured the impact of any budget reductions and if they have adjusted resources accordingly. Lastly, we're looking for information on the deaths of children who were in each of the 4 counties. Examples would be the number of deaths, demographics, placements, etc. So I'm happy to answer any questions you may have, and I respectfully request your support. Thank you.
Thank you, Mr. Perea. Mr. Auditor, go ahead.
Thank you, Mr. Chair. As Assemblymember Perea indicated, we will sample 4 counties in the state of California. But before we do that, we'll be conducting some work at the Department of Social Services and looking at what their role is in providing guidance to the counties, any monitoring responsibilities they have as far as monitoring CPS entities at the counties, and what they do really to assist the counties in preventing tragedies in the future with regard to child abuse. We've also been asked to look at 5-year trend, looking at major expenditures that have occurred over those 5 years and their budgets for the counties. Again, this is focused at these 4 counties. Looking at the number of social workers within each of these 4 counties, the caseload, whether the caseloads have changed as far as the number of cases the social workers are having to manage, and to compare those ratios to standards. We conducted an audit. Actually, I worked on the audit back in 1998, where we had gone to Kern County and did some work there, and actually looked at some other counties through survey and got some information related to caseloads. And there are some standards that both the Department of Social Services have, and then there's a Child Welfare League of America that establishes some recommended standards as well, so we could do some comparisons there. In addition, looking at the budgets, what impact budget reductions have had on the counties, particularly the CPS, and what adjustments have the counties had to make to be able to deal with those budget reductions. Looking at the policies and procedures at those 4 counties, whether or not they're well designed to protect children from abuse, whether there's been any guidance received from DSS, have they implemented that guidance. In addition, looking at a sample of placements for each of these counties, and again, looking at whether or not the CPS entity followed appropriate protocols as far as placing children, the timeliness of removing children when they've determined that it's in an inappropriate placement and that child is in danger. How prompt has CPS in that particular county been in removing that child? In addition, looking at collecting some information, this would be over a 3-year window, looking at reports of child abuse, the disposition of those reports, how much time it took the CPS staff in that particular county to visit or make contact when they have received an allegation of abuse, and looking at the visitation. And then, as Mr. Perea indicated, trying to collect some information on child deaths. Subsequent to the audit we did back in 1998, we did a follow-up audit in 2000. I was looking at that early this morning and found some legislation that was enacted that actually put some responsibility on the Department of Justice to collect information and actually requires DSS to work with DOJ to establish a database to track child death cases, and this is something that we didn't see back in 1998. So I think we'll be able to do some work at the Department of Justice, collect some information related to, is that system up and running? Is it working? Is it going to give us the information that the member is asking us for? And that would be the number of child deaths, the cause of the death, the demographics. Was the death related to an abuse or neglect situation? So we would be able to collect, hopefully, that information for a 3-year window, both looking at what DOJ has as far as this database and what DSS has, because DSS has its own database on child welfare system, and within that database, the legislation that was enacted back a few years ago required them to have some fields in that database specific to deaths related to abuse and neglect. So we think we have some resources that we can go to at the state level to capture some of this information, and hopefully that'll create some efficiencies with the audit. In addition, there's a death review council. When we conducted the audit back in 1998, we surveyed the counties, and we found that most counties in California have what's called a child death review team, which is a team that goes in and looks at what went wrong, or what did we not do well that unfortunately resulted in this child. Are there things that we could have done as an entity at the local level to perhaps have prevented this death? So we think we're going to be able to collect some information related to any evaluations that are occurring at these 4 counties in these child death cases, because there is this review team that really takes a hard look at policies and procedures and to determine whether or not they have followed those or whether or not they need to improve those. So I think that will help. The last step is to look at best practices to determine whether they're within those 4 counties we visit. We'll certainly look for best practices, and then we can do some research at a national level to see if there's anything that California can benefit from that may be occurring in other states, models or policies or procedures that work well. The budget for this audit is about 3,800 hours. Again, as I indicated earlier, this is because we're going to be looking at DSS, DOJ, and visiting 4 counties. But we certainly think this is an audit we've done in the past. We can, again, leverage some of the experience we've have from that. But I think we may be also able to gain some efficiencies from information that's housed at the state level. So with that, I'm happy to answer any questions members may have.
Before we go to questions, I want to make sure we get comments from the affected agencies or members of the public. Is there anybody? Go ahead.
Mr. Chair, members of the committee, Kevin Gaines with the Department of Social Services, Children and Family Services Division. Just let me say from the outset that we welcome the audit and any opportunity that we have with our stakeholders to examine, re-examine the system, to determine where there are holes in the Child Protective Services network and make efforts to improve those areas. That said, pulling in from the 1998 audit, there's been a number of systems improvements that have taken place both at the state and local levels that we believe allow us to do a better job in protecting children and preventing abuse and neglect. There are, as the single state agency responsible for Title 4B and 4E programs at the federal level, 4B dealing with generally a network of programs aimed at child abuse and neglect prevention, and 4E providing resources for foster care and for care out of home placement. As the agency responsible for administration and oversight of those programs, we have put in place a fairly rigorous set of state and federal accountability measures that track literally thousands of outcomes and outcome-based benchmarks related to the Child Protective Services system, focusing on outcomes versus process, and focusing on safety, well-being, and permanence for children. As such, we have in place now a fairly regular system of visits with our DSS staff interacting with counties, providing site visits, desk reviews, reviews of our case management system database in order to develop and maintain systemic improvements over time, and it's a continuous improvement process that never ends. Relative to fatalities, we've put in place some.
Just wrap up your comments really quick. Good.
Sure. Happy to answer any questions you have.
Thank you. Senator Rubio.
Thank you very much, Mr. Chairman. Thank you, Auditor, for your thorough overview and your mention of the Kern County audit. I was in this building in a different capacity when those items were brought forward, and I will tell you, colleagues and members, what a difference an audit can make. It had a profound impact on the practices that occurred within the County of Kern and CPS, but we still have a lot of work to do, and so I want to thank Assemblyman Perea for bringing this forward, and I'd like to make a motion to move forward on this audit. But I do have a question. One of the things that the Child Welfare League of America found as they came and instituted some best practices within the department as it pertains to CPS, one of the alarming findings that we observed in our trending was that in the reunification process, when children were taken away and then the mother, oftentimes single mother, not to single them out, but that's often the case, we reunited, and in the follow-up process with social workers in the CPS division, then if they failed the drug test, that alone was not sufficient grounds to remove the child and take them back in, pursuant to existing state law. We found, however, whenever the parent, whether it be man or woman, was found to fail a drug test specific to methamphetamine, crank, as it's an epidemic status in the Central Valley, it was almost inevitable that the child was going to be neglected and beaten again. And so I'm curious, in your audit, will you be able to drill down as far as to establish trends to see if that is an occurrence within the large counties that you will be sampling?
Senator, specific to the question about whether or not they're screening parents for drug abuse and pulling children out of that particular placement, or I'm not clear on what your question is related to trends.
If there will be similar findings in that where there are cases of severe abuse or near fatality cases, could you also look to see if there were drug activity specific to methamphetamine? Perhaps that's a different way of putting it, if your audit will be able to identify such findings.
I think when we're looking at some of the practices that the Child Protective Services agencies use and some of the follow-up, because we do have a step related to looking at placements and then determining whether or not the child needs to be removed immediately upon the additional information that CPS becomes aware of. Another step will be looking at assessing their policies and practices related to visiting that child's residence and assuring that that child remains in a safe environment. So I think we may touch on that. I don't know if we're going to be able to get at exactly what you're asking for, but we can certainly be cognizant of that and see if the information that we are looking at these 4 counties gives us the answer for you.
To just be on the record very specifically, I think what I'm looking for is in cases where severe neglect or severe abuse, rather, or near death or even fatal cases, if in reviewing those cases, whether or not you find that there was a relapse in drug, and specifically with methamphetamine, I think that'd be important for the committee to hear. But thank you for bringing that forward, and I'll move on that, Mr. Chairman.
Thank you, Senator. Mr. Alejo.
I also want to thank Assemblymember Perea for raising this issue. I think it's been quite a long time since there's been a review of CPS. It's 13 years ago, and when you have 3 tragic deaths in your county, I just want to commend you for raising the issue and really getting the state involved. I think it's necessary for the state to be involved in looking after the best interests of the most vulnerable. Having worked in the family law court and having assisted dozens of families, mothers and children getting domestic violence restraining orders, I'm very sensitive to this issue. We've seen what it does to families firsthand, and young children not having anybody to look after them in many of these very emotional, very difficult situations. So, and then I think you pointed it out with these tough economic times. There's a lot more strain in the family, a lot of more complex issues within the home, and I think that's what you're seeing a rise just in the caseload and the reports that CPS has to handle. So I just wanted to second the motion, but I also wanted to see if this audit would also review the protocols that CPS workers have with the dependency court, where the judges end up making a lot of the permanent orders after the fact. After CPS got involved, permanent placements, the whole reunification process, whether it would also look at that, because I think that's an important piece of this procedure. But also another issue that was concerned to me was just I understand these CPS workers have a heavy caseload in many times. A lot of them are doing great work, and putting in immediate orders, something that we can't even do with the restraining order. CPS has different powers to provide protections, immediate protections for children facing abuse, domestic violence, and neglect. But also, I want to make sure that we're looking after that there's an adequate staffing level as well. I know it's difficult, but when you have them with such heavy caseload, it also brings up the question, can they provide that proper oversight in all the different cases that they're handling? So I was wondering if the audit would include those issues as well.
The second issue that you mentioned with regard to the number of social workers and caseload is a specific objective that's included in the audit report. It's objective 3, where it says identify the number of social or caseworkers, caseload per worker during the 5-year window. So we'll be looking at trends. In addition to that, as I indicated, as we did in the 1998 report, we'll be able to compare those caseloads to available standards, both standards established by DSS and in the last report back in 98, we compared it to standards that Child Welfare League of America recommended. So we will look at that. With regard to your first comment on orders from the family court, I really honestly don't know the answer to that. I think we will be looking at the counties and the CPS entities, what their protocols are, and we'll be evaluating placements. And we may touch on your first question related to that when we're looking at placements where the court has made a decision of what that placement should be. But certainly looking at the protocols as far as CPS, okay, the court has made a decision, the placement has been made, but you've received additional complaints of potential neglect or abuse. How responsive have you been to those, and have you deemed that to be an inappropriate placement and taken the appropriate action? We would be able to get at that, I think, with some of the objectives we have in the audit.
Thank you. Next we have Senator LaMalfa.
Thank you. Mr. Rubio's point earlier, I wanted to follow on that as well and get to the core of, as part of your audit, will it be that reunification, especially being reintroduced back into a drug situation? I'd like to hear about and wonder if the part of the audit is that what is the success ratio or the non-success, and then anecdotally, also you hear of incidents where you might have what would normally appear to be a well-functioning family, but one incident happens, and it seems in cases where you have CPS actually very aggressively enforcing on a one-time incident family, and then you hear on the other hand where reintroduction of children back into those drug homes over and over and over again. It seems very frustrating on the outside anecdotally when you hear about such things. And so I would hope there'd be an element that come out of that to show these ratios and how those elements are working there. But also, I wanted on the 4 regions, Northern California, how's that defined?
What's that?
How do you define Northern California? Because also you have Bay Area as a region, and Central and Southern. As far as the counties that you'll be selecting, do you have those kind of in mind already? Because I would suggest that there's a lot of Northern California, north of Sacramento, that doesn't normally get lumped in with, everybody thinks San Francisco is NorCal. If you look at the map, it's almost on the center. But anyway, I just wondered what you're looking at as far as a NorCal representative county, and if I could perhaps suggest, you're looking for the largest counties, Shasta, Butte, or perhaps even Placer are. And the reason I'm saying this is that you have a different perspective on a large rural county if those two. Sure.
Well, we could.
South of Sacramento, Southern California, from where we are, but you.
Sure, Senator. I mean, we could definitely work with the auditor to create that that definition so that we have a really diverse representation. I mean, the whole idea is to make sure that we have a diverse representation throughout the state, so we can have a really good picture of how we do that. And so I don't know if you have any thoughts on how we do that, but certainly we can go back and refine that.
Right, because I think an important element is that you would have a rural geography with the challenges you have of long distances traveled for the personnel, sometimes to be able to do visitations or respond when, let's say Reading is that hub, for example, and you got to go 100 miles to still be in the same county so that could be an important element you'd want to look at in the audit as well, that a large rural county would be one of those represented. So.
Sure, and Senator LaMalfa, as we indicate in the analysis that we wrote of the audit request, it says 4 counties by population or any other criteria that we would think is appropriate. So as we get into the report, because usually when we are asked to look at regions, we don't necessarily, with all due respect, just focus on population. We may want to try to get at what happens in a rural area as opposed to an urban area, and then use population, use perhaps some statistics that we can get from social services or DOJ to really kind of identify and target areas within California that we should visit. So we could certainly consider that if he's welcome to allow us to do that.
A good all-around mix. I appreciate that.
Yeah. Thank you, Senator. Next we have Mr. Wagner.
Thank you, Mr. Chairman. And Mr. Prey, you mentioned that it's a lot easier up here, but the fact of the matter is being down there is where the work gets done, and you're to be complimented for bringing this to us. A couple of quick either points or questions, and one is there's a concern I have with, as I believe Senator Rubio mentioned, with increased enforcement or auditing, we end up having increased enforcement and perhaps a situation that, like Senator LaMalfa mentioned, that perhaps innocent parents with an anomalous situation, a one-off situation, get swept up. I mean, even I've got a story. My son broke his jaw in his doctor's office getting a physical and had to have his jaw wired shut. There were dozens of witnesses, medical personnel. We got a call from Child Protective Services asking if there was anything they could do for us. So we have to be careful that innocent folks are not swept up in these concerns. And I raise that to perhaps suggest that instead of looking at 4 counties, if there's a situation in Fresno that deserves attention, you absolutely are right to focus on that and bring that to us, especially as we go into a year with realignment, and some of these services, as I understand the governor's proposal, might end up devolving down to the counties and lower levels. So I guess my question is to avoid sweeping extra counties into this, if it would be possible to focus on Fresno, take a look, audit Fresno, see if there's a particular issue there that absolutely needs to be addressed. Some of us seem to think government does too much, and that's probably true, but one thing it appropriately does is protect the weakest among us. So if there are problems in Fresno, let's address those and then come back after the realignment proposal shakes out, see if other counties need to be involved, see if instead we need to keep an eye on what the counties are doing with realignment. I guess that's a long way of saying, can we scale this back a little bit and see if we have a real problem in Fresno?
I'm more interested in seeing if we have a statewide issue, because it's not just an issue that is just occurring in Fresno County. I mean, I gave you the example, of Seth Ireland. I mean, and I appreciate your concern about, folks that are, innocent folks that maybe get caught up into something, or you don't want this kind of sweeping kind of maybe witch hunt of folks. I get that, and I don't want that either. But I do think that it's important for us to look at this statewide, to look at trends, to look at best practices, to look at what opportunities are out there to improve the system statewide. So my hope is that by limiting this audit to only 4 counties, that the findings from that audit will allow counties from throughout the state to benefit from those findings and allow improvements to be made within their own systems. And so I do think that this is important to keep it statewide. I do think it's important that we not limit this to just Fresno, but do 4 counties, because I think it'll give us a better representation and really a better work product at the end of the day.
Thank you. Next we have Mr. Monning.
Thank you, Mr. Chair. I also want to thank Assemblymember Perea for bringing this to our attention. My question goes along the lines of Senator LaMalfa's on the designation by region, one of the criteria being county population. But correct me if I'm wrong, but what I heard from the auditor, there'd be a preliminary surveillance, not just limited to population of a county, but maybe indices of reported incidents or deaths that might narrow down into a county that wouldn't necessarily be the main population center. Was that accurate?
I think that's accurate, and as Mr. Perea agrees, I mean, his suggestion was population. We asked if we could put in any other criteria we thought would be appropriate, because we'd like to have that flexibility to be able to look beyond population and perhaps go to a county that we otherwise wouldn't visit.
And then a selfish question: how do we define Central California? assuming that includes Fresno, which is kind of the focus. And I certainly want to support Assemblymember Perea in that follow-up. Sure. But both my colleague, Mr. Alejo, and I represent sectors of Central California as well. So, to the extent appropriate, we would like to be included, at least in that surveillance that might lead to some even follow-up outside the audit that just might inform our own engagement with our local social service departments.
Well, I consider Fresno as part of Central California, and considering the issues that we've had in Fresno, that is definitely one area that I'd really like to delve into.
Right, and I'm fully supportive of that.
Thank you,
follow-up. Thank
Mr.
you.
Monning. Thank you. We have Mr. Donnelly.
Thank you, Mr. Perea, for bringing this important issue to light. And I just have a concern. One of my chief of staff attended a briefing where he was given a statistic, and I just still find it mind-boggling, that 2/3 of the children that are removed from homes that are on CalWorks. And I'm wondering if this abuse and if it's related to the fact that, as Senator Rubio was talking about the drug use, if that is tied to, and if we are subsidizing this, and if that, if being on CalWorks becomes a contributing factor versus people who have a job. And I know that Fresno County has one of the highest unemployment rates. There's a part of my district that has a massively high unemployment rate, and I'm concerned as to whether or not we are, by funding this, creating a situation where children are put at risk. And is that something that you guys have? I notice you have a lot of factors that you're looking at: ethnicity, age, location, but what about employment and what programs they're on? and what kind of requirements there are to be on those programs.
Certainly that's something that we have not talked about in our office. I don't know if the auditor has any suggestions on that, but that's something that we have not talked about, and I'm not sure, what that would really produce, in terms of real information to actually rectify the problem. But
as far as the scope of the audit, I'm scanning the objectives, and I'm not seeing something specific to identifying whether or not the individuals who these children are placed with, either biological parent or some other guardian, is benefiting from CalWORKs. I don't see that in the audit objectives right now. I don't know if there's information that we could glean from Department of Social Services when we look at some of the data. I don't know if the gentleman from DSS can talk about that, but currently, as the objectives are laid out, that wouldn't be something that we would be identifying.
yeah, quite frankly, I think that regardless if a person has a job or not, there's still issues within the system that we need to look. And so I think I'm not sure how relevant that question is to really identifying some meaningful information that would move this issue along.
Yeah, I'm thinking more of the children themselves, and ultimately whether or not they're in an environment that's safe and productive, or do we just keep removing them from one environment, putting them in with a relative to another environment that's essentially just as dangerous? Or, is that part of the whole equation? And is this dependence on a program as opposed to having work which brings a certain amount of pride in oneself? And look, all of us that have children, our kids can drive us nuts once in a while by being around them, too much. So is there some component of that? I'm just curious, because when you have a statistic like 2/3 of the people are on one program, it just struck me as just a really inequity and imbalance. So thank you.
Sure, thank you.
Thank you, Mr. Ali. Next we have Senator Norby.
Of innocent life is a core government function, and I understand your concern, Assemblymember Prey, about your specific county, and I appreciate that, and I could support it, but I'm reluctant to expand it because in your letter, I'm looking at your letter here to us, dated February 14th, and the fourth line, it says, this increase in Fresno County is nearly 4 times the statewide average, referring to your county, and I can understand your concern there, and that's why I think it's legitimate to look at Fresno County, but to expand this to other counties that don't have this anomaly and spend about $400,000 is not really focusing on, I think, what you want to focus on. Just saying that child abuse is a growing statewide problem, well, certainly any child abuse is a problem, but overall crime is actually down in California. In fact, it's shown that the more crime declines, the more people are afraid of crime, maybe because of all the crime shows. I mean, you can see Nancy Grace at all hours talking about certain criminal activities that we should be concerned about. But if you look at murders in the city of Los Angeles, for example, they're half of what they were in the 1960s and 70s. And with child abuse, it's a tough issue because...
Mr. Norby,
yes.
I just want to put a point of clarification. Right. During the hearing, we cannot expand the audit request or change it in any way, just so the members know.
All right.
Thank you.
Well, I'm suggesting that I would be more receptive if it came back to us and focused on Fresno County as opposed to the other. My concern is it's overly broad and that it's not focusing on what the author really wants to do. Also, since we do have realignment coming up and this whole issue is going to be looked at, I would hesitate to get involved in as broad an audit for something that might be something that is specific to the county he's concerned about.
I understand. Appreciate your comments.
And if I could just maybe briefly respond to that, I mean,
hold on a second for me. Let me just. We want to make sure we're brief. We're losing members, and I want to make sure we get to everybody's audit request. So, if respectfully, okay, Senator Alquist.
Thank you very much. I may be asking a few things that were mentioned before I came. I was in Senate Education Committee, which meets on Wednesday mornings. So I have some questions of the department, and I know the state auditor, I know you can't change things, but I know you will, being very diligent as you are, that you can kind of pick up on maybe some of the things I'm talking about. Also realize that even should we approve this and it comes back, it still could be a long time before anything is done statewide. So, question for the department, how do you define child endangerment?
Endangerment?
Yeah.
I'm not. Dealing with abuse or neglect are the things that is the scope with which we generally deal with, and I believe the Welfare and Institutions Code is pretty specific as to the set of issues that constitutes abuse or neglect. I mean, I think it's
so
pretty,
you have a
pretty
real
well-defined.
written definition that you use in your procedures.
I think we have a fairly broad set of definitions, but a lot of the determination of whether abuse or neglect occurs or whether a kid's safety is in jeopardy is left up to the discretion and judgment of a social worker who surveys the scene.
So it could vary social worker by social worker.
Yeah, there are certain factors that are left up to that well, educated discretion. Yes.
Sure. A couple thoughts. One is that if you could please get your written definition of child endangerment to the chair of this, to our chair here.
Child endangerment.
I would really appreciate it, and then I would also suggest that, and I think social workers do a fantastic job. I would also suggest that, because I think we're looking at what are best practices in statewide procedures and how what may come out in the audit, and I can see a good reason to be doing 4 different areas, and I am proud to represent almost 1 million people in Santa Clara County, and I know we have our Vice Mayor of San Jose here, Madison Nguyen, and one of our members, Don Roca, who used to work for me many years ago when I was in the Assembly. I believe that we probably should be looking at some statewide practices. I think for one child to die is way too much. And I'm going to be guessing that there are things that we could accomplish. So a few more questions to ask is, once, back to the department, once you realize, or let's say once the social worker realizes that a child's safety is in jeopardy, what happens then?
Well, depending on the severity of the situation, I mean, a determination is made whether a child can be left safely within the home or with a set of services that are suggested to the family, or whether a removal is warranted. And you know, there's a fairly high standard, that a legal standard that warrants removal.
Okay.
And that standard is reviewed by a court.
I understand that we're short in time, so I'm just going to put out 3 or 4 statements and not ask for any comment. But it seems to me that statewide we need some real definition, so that statewide we know that our children are protected. And another comment is that I'm not asking you to answer this at this point, but to send a letter to our chair, is how is information captured and made available to the public as to when a child is in jeopardy? Another comment would be, what is the use of technology from county to county, so that if a problem is established in one county and the family moves to another county, how does the social worker then appear in the other county to help that family? And my last comment for now, only because we're short on time, would be, I think the child's safety is the most important factor. And I think once in a while we put the family first, and that's very important. I'm a grandmother. I'm a yaya. That's the Greek word for grandmother. Family is really important. But the child's safety comes first. And I just want to be sure that in all your procedures somewhere, on the short list, that one of the criterion is that the child's safety is put first in placement. Thank you.
Thank you, Senator Alquist. Appreciate your comments. We do have a motion and a second. Secretary, could you please call the roll?
Laura?
Aye.
Laura, aye. Alejo?
Aye.
Alejo, aye. Donnelly? Huber?
Aye.
Huber, aye. Monning? Aye. Monning, aye. Norby? Wagner? Wagner, aye. Alquist? Alquist, aye. Anderson? De Leon? Dutton? LaMalfa? LaMalfa, aye. Rubio? Rubio, aye. Wolk?
Thank you. That request is on call. We'll keep the roll open. Thank you. Next item is by Senator Rubio. That's item 2011-104, and that's tab C, members, on your binder. Senator Rubio.
Good morning, Mr. Chairman, and members of the committee. Thank you very much for allowing me the opportunity to present this request to you and for your consideration on what I believe is a very important audit and review of a group of local initiatives that have, in this light, never been reviewed, and it's a possible opportunity to find funding and best practices at a time when we desperately need it in the state. As you know, there are 12 local initiatives in the state of California, 12 respective counties that provide administration duties for Medi-Cal and healthy families. Each of those local health plans are required to have what is referred to as tangible net equity, a reserve on hand to be able to provide for the lives that they are administering within the Medi-Cal and healthy families insurance plans. And brought into question locally in the county in which I reside in is Kern Health Systems, where they have nearly 800% beyond the tangible net equity on reserves, while there have been significant questions brought into play with respect to an $8 million contract, whether or not it was sufficiently approved and put through a rigorous process in a best practices format. Second, the issue of the significant gap that exists in the county as it pertains to those who are unemployed, whether or not they're fulfilling the intent and the role of the local initiative. And mind you, while I'm not against folks making money, local initiatives are funded 100% by taxpayer dollars. And right now, they are considering giving substantial raises where some of the folks who work there make well over $300,000. And so I think it is time in the state where the local initiatives, those who have significant reserves well beyond what is required by law, to be audited, to be reviewed. I will close with this. There are good local initiatives in this state, and I don't want to cast aspersions or a negative across the state. There are many who are doing the fine work that is fulfilling the intent of the letter of the law. However, I think it is time to audit, review it, and see what we can find, and I would respectfully request your support of this audit.
Thank you, Senator. Ms. Howe.
Thank you, Mr. Chair. As Senator Rubio indicated, we'll be looking at some responsibilities at the state level, but certainly visiting a sample of these local initiatives. But starting at the state level, we believe we would need to visit a couple of entities at least. That would be the Department of Health Care Services and the Department of Managed Care, because the limited research we've done thus far, we understand that those two entities would have some role and responsibility with regard to what's called the two-plan model and working with these local initiatives. And looking at what the state agencies' responsibilities are for overseeing and monitoring the composition of the balances that these initiatives have. In addition, looking at controls of the oversight agencies and making sure that they have appropriate controls to ensure that taxpayer dollars are used properly. What the role of the state agency is in the event they understand or that the local initiative has been audited or has been reviewed and there's some corrective action that needs to happen, whether or not the state entities are ensuring that that corrective action actually takes place. But then we would need to go out and visit a sample of the local initiatives. Senator Rubio has asked us to visit Kern Family Health Care, but we would certainly sample some other initiatives. Again, we'll try to base that on information we can gather at the state level. But when we go out and visit each of these initiatives, first thing we'll do, look at revenues and expenditures at each of the initiatives. Senator Rubio has asked us to look at a 5-year window. I'm assuming that's to look for trends in both revenues and expenditures and these equity balances. As he indicated, he's asked us to look at salaries for top management. How are the decisions made as to what those salaries should be? In addition to that, what the current salaries are for top management at each of these local initiatives. Moving on, identifying the balances, this tangible net equity, what the balances are. There is some specific requirements in state law with regard to those balances. Identify those that may have excess balances at these local initiatives, reasons for those excesses. Discuss with the local initiatives why are they carrying such excessive balances, and to determine, if we can, the impact on beneficiaries. The fact that they're retaining an excessive balance, is that having a negative impact on the ability of that initiative to provide services to beneficiaries, to deliver services? And then finally, looking at, again, at the local level, their fiscal practices and policies, their processes, making sure that they have proper controls at the local level, again, to ensure that funds are properly received and used appropriately for the appropriate purposes. And looking at corrective action, again, at the local level. I talked a little bit about at the state level, but really understanding what they're doing at the local level to correct any concerns that have been brought to their attention. The audit is a little over 3,500 hours, again, similar to some of the other audits. The hours are driven by the work we have to do at the state level, but again, some of the work we intend to do at the local level.
Thank you, Ms. Howell. Any public comment?
Tanya Hammond with the Department of Healthcare Services, the Medi-Cal Managed Care Division. Good morning, Mr. Chair and committee members. I just wanted to let everybody know that the Department of Healthcare Service certainly will cooperate with this committee as well as with the state auditor should we proceed down this path. I would also recommend consideration to also look at the impact to the health plan's ongoing sustainability and the impact to the managed care as a whole in the department or for the state of California should there be expropriation of any reserves. Thank you.
Thank you.
Thank you, Mr. Chair, members. Jim Gross on behalf of the local health plans of California, which include all of the local initiatives that have been discussed here today. A couple of issues of clarification. I think, first of all, the auditor did a very good job of explaining the role of the local initiatives. I do want to point out, however, that these local initiatives are licensed and must practice exactly the same way that the commercial plans in California that also participate in the Medi-Cal program. In that way, there is no distinction. All the same laws apply, all the same audits apply, et cetera. Mr. Rubio has had an ongoing concern about the reserves, and he cited that Kern is at a point of 800% over the statutory requirement for reserves. As the auditor will find out in discussing this issue with both the Department of Healthcare Services and the Department of Managed Healthcare, the minimum tangible net equity requirement is not where the department wants you to be. It wants you to be well over that. Once you are at the minimum, there is a risk that the department will have to step in and potentially even take over the plan. The other thing is that 800% by any measure sounds like a lot. We have provided, Mr. Rubio, and will provide the auditor with a document that illustrates that 800%, for instance, would amount to approximately 4 months of operational capital, which would mean that, for instance, as it has happened the last couple of years, when the state does not enact a budget, those reserves are used to pay providers for services rendered, even though the plans are not being paid by the controller. So it is important, and I think this is what Ms. Oman was referring to, that you understand that those reserves, and I'm sure there's a lot to look at with respect to them, and we agree with Mr. Rubio that many questions remain, but it is important to understand that without that money, providers would not get paid during a time when the state is unable to resolve its budget issue. Right. Thank you very much. We intend to work very closely with the auditor to help in any way we can.
Thank you. Mr. Rubio, do you have a point of clarification?
Only that I thought I could not get a better person to support this audit than what Mr. Groves just highlighted. A lot of these questions are outstanding. Does it need to be codified? Do there need to be laws to set forth that the tangible equity is too low? We don't know these things. There are unanswered questions, and that's why I think it is a very timely and appropriate opportunity to do the audit, and once and for all have a third-party independent objective review of these local initiatives, and then we can move forward as a policy body.
Thank you. Appreciate that. Mr. Wagner.
Thank you. I think actually most of my questions have been answered. I was looking to see what limits there might be on use of these tangible net equity balances, but it does look like you'll be digging into that and maybe coming back to us telling us what all the requirements are. We just heard from Mr. Gross, so thank you. My questions have pretty much been answered. Thank you.
Thank you. Is there a motion?
I'll move to approve.
Second.
There's a motion and a second. Secretary, please call the roll.
Laura?
Aye.
Laura, aye. Alejo?
Aye.
Alejo, aye. Donnelly? Huber? Monning? Aye. Monning, aye. Norby? Wagner? Aye. Wagner, aye. Alquist? Anderson? De Leon? Dutton? LaMalfa? Rubio?
Aye.
Rubio, aye. Wolk?
Thank you. That request is on call. Next, we have Mr. Monning presenting on behalf of Mr. Speaker. That's item 2011-106. That's tab E in your binders, members. It's the last item on our agenda today. Mr. Monning?
Thank you, Mr. Chair. Members, in November of 2000, the California State Auditor issued a report, State-Owned Intellectual Property. Opportunities exist for the state to improve administration of its copyrights, trademarks, patents, and trade secrets. Since that time, technology has advanced, and without sufficient knowledge of how to protect intellectual property, state agencies will become increasingly vulnerable to unauthorized use and inability to capitalize on reduced contract costs or increasing revenues to the state. It is my understanding that recent government accounting standards now require the annual reporting of intangible assets in the state's financial statements. Therefore, the state has begun tracking certain copyrights, trademarks, and patents to report as intangible assets in these statements. As the preparer of these financial statements, the State Controller's Office collects information from state agencies to report in the statements. Although the state may have a process in place to collect and report this information, this process may not address the risks related to protecting and managing the state's intellectual property. On behalf of Speaker Perez, I am respectfully requesting an updated audit of how the state agencies track and manage intellectual property, an evaluation of any state laws, legislation, or reports related to intellectual property since the publication of the 2000 IP report, including best practices used by California's research universities to protect and manage their intellectual property, along with the detailed questions provided in the letter submitted by the Speaker. I respectfully request your support of this proposal. Welcome the comments of the auditor and experts here in support. Thank you.
Thank you, Mr. Monning. Ms. Howe?
Thank you, Mr. Chair. As Assemblymember Monning indicated, this is a request by the Speaker specifically asking us to follow up on some of the work that we did back in 2000, but also adding some additional information that I think would be important to the state of California. The first objective, we're being asked to look at the legal environment to determine whether there have been changes. When we conducted the audit back in 2000, there was not a lot of guidance either from state agencies or even in state law, and we made several recommendations for legislative change. So I think that Mr. Speaker is asking us to determine what has been put in state law, and have there been attempts at legislation that have failed. So he's asking us to look at both. So we intend to have attorneys in the office do some research for us in that particular area to accomplish that objective. In addition to that, to look at some control agencies. This would be the Department of Finance, the State Controller's Office, certainly, the Department of General Services from a contracting perspective, our new technology agency, whether or not those agencies have provided additional guidance or policies to assist state agencies in identifying and protecting intellectual property. The audit back in 2000 really identified a void in the amount of guidance that was available to state agencies, and agencies were really struggling with determining what is intellectual property and how do we go about protecting it. A perfect example is from the 2000 report, we identified several state agencies that didn't realize that the design and development of their website is state intellectual property that should be protected for the state of California. So in looking at these control agencies, not only whether or not they're providing guidance and policies to state departments, but are those control agencies coordinating with one another to make sure that the appropriate guidance is being given and to make sure that the state's protecting as much of its intellectual property as it can and identifying intellectual property. Asking the central agencies to the extent they followed up on any of the recommendations that we made in 2000. As I said, many of the recommendations were legislative, but we still will ask them, related to the theme of that particular recommendation, have they done anything as far as providing guidance, regardless of whether there's been any statutory changes. In addition, to look to see if there have been studies or reports on intellectual property. As Assemblymember Monning indicated, technology has changed significantly in the last 10 years, and as we know, it changes daily. An additional objective would be to talk to the Attorney General's office as far as any actions they've taken to protect the state's intellectual property in interest in a court of law. Have they been engaged in any actions, again, to assist the state of California? The fifth objective is related to contract language. We believe we would need to spend some time at the Department of General Services looking to determine whether there's state standard contract language allowing state agencies to protect, again, intellectual property. We've seen instances in the past where the state would contract for a vendor to develop a system, but that contract language didn't include language that would say once the system's developed, it's the property of the state of California, as opposed to the vendor being able to market that particular product in the future. In addition, we would go to a sample of state agencies and look to see what those state agencies have done to identify, protect, their intellectual property, what guidance they've received from state agencies. Do they feel that they have the ability to reach out to these entities to provide assistance? We do know that the Department of Finance has put out some information related to identifying intellectual property to assist the departments in reporting to the State Controller's Office to comply with this new, it's called GASB, it's Government Accounting Standards Board, where they set standards for how financial statements should look and what should be included. So we have seen some guidance, and we'll take a look at that. We'll also leverage the work that our financial audit team is doing. The financial statements will be issued, in our opinion, will be issued in March of this year, so we will benefit from some of that experience. We've already looked at this area to a certain degree with respect to the financial statements. Again, at the state agency level, the sample of state agencies, what efforts are they undertaking to maximize the potential if there's an economic benefit that California can attain from its intellectual property? What are we doing to accomplish that? And making sure that state agencies do have the appropriate contract language, whether they've received guidance from DGS or not. Are they on their own initiative, making sure they're doing everything they can when they're drafting contracts and entering into contracts to protect intellectual property. Another area that we're going to look at is California's research universities. The University of California, it's my understanding, does a very good job. They develop a lot of intellectual property, as you can imagine, and do a very good job of protecting that for the university. So perhaps the executive branch can learn from what we find out in reaching out to the University of California, so we certainly intend to do that. And then the final step is similar to what we did in 2000, and again, this is driving the cost of this audit a little bit, is to try to provide a summary of state agency-owned intellectual property. The previous audit, we actually surveyed over 200 state agencies and got responses from pretty much all of them, and it was very informative as far as the types of intellectual property they've identified, how they're going about protecting it, So we would expect that we would, to the extent we can, do this similar type of survey to see what amounts of intellectual property and what types the state currently owns. The audit, little over 3,000 hours. And again, depending on staffing, it would take us approximately 6 to 7 months to be able to complete the project.
Thank you, Ms. Howe. Any public comment?
Yes. Good morning, Chair and committee members. My name is Mike Havey, and I'm here on behalf of the State Controller's Office to address the compliance and implementation of GASB Statement 51, Accounting and Reporting for Intangible Assets. The requirement of GASB 51 are effective for the financial year statements for periods beginning after June 15, 2009. So therefore, the effective statements will be the 2009-10 financial statements. We are currently having those audited right now. Field work should be done probably here pretty quick, and we'll issue those in March. With the assistance of Department of Finance and the work of the Bureau of State Audits, the financial statements to be presented in the state's comprehensive annual financial report should be in compliance with the requirements of GASB 51. And the only reason I say should be is because the field work hasn't been completed at this point in time, but we have not seen any problems or issues with that.
Great. Thank you so much. We're going to move to questions. Mr. Alejo?
I just want to make a motion to approve, and I think this is from a business standpoint, it's a very necessary audit. I think any business nowadays is highly protective of their intellectual property, and many times they're very vigorous about defending those rights in court, when there are those violations that exist. So I think that connection with also reviewing or looking at the involvement of the Attorney General's office in protecting those rights, I think that's very timely. But I think with the current economic situation, also making sure that our state is maximizing the economic benefit of that intellectual property is also very important, and I think the taxpayers would expect that from us as well. So I want to thank the Speaker for requesting this audit, and I just want to be there to support it.
Thank you. Senator Alquist?
Thank you. Appreciate that the Speaker has presented this. I think it will end up resulting in some real dollars in revenue to the state budget. My other comment is I had a bill signed into law last year, which was the first one that created some real oversight of the California Institute for Regenerative Medicine, and we'll be really eager to look at your report as State Auditor on strengthening management controls. Thank you.
Thank you so much, Senator Alquist. We have a motion and a second. Secretary, please call the roll.
Laura? Laura, I. Alejo?
Aye.
Alejo, I. Donnelly? Huber? Monning?
Aye.
Monning, I. Norby? Wagner? Wagner, I. Alquist? I. Anderson? DeLeon? Dutton? LaMalfa? Rubio? And Wolk.
That request is on call as well. I also, at this time, want to lift the calls on several of the items so we can allow members that were absent earlier to vote.
Thank you.
Secretary, can you lift the call on Perea?
Donnelly? Norby? Anderson? DeLeon? Dutton? And Wolk.
Okay, that is still on call. Let's open the roll, lift the roll on Senator Kehoe's item.
Alquist? Alquist, I. Anderson? DeLeon? Dutton? And Wolk. Still on call.
Still on call. Let's lift the call on Senator Rubio's item.
Donnelly? Huber? Norby? Alquist? Alquist, I. Anderson? DeLeon? Dutton? DeLeon, I. Dutton? LaMalfa? Wolk? Still on call.
Still on call. We'll lift the call on the Speaker Perez's item. Secretary, call the roll.
Donnelly? Huber? Norby? Anderson? DeLeon? DeLeon, I. Dutton? LaMalfa? Rubio? Wolk. That's still on call.
The item is still on call. Okay, we're going to lift the call on Mr. Pereira's item. If Secretary, please call the roll.
Donnelly, Norby, Anderson, DeLeon. DeLeon, aye. Dutton, Wolk. That one's out.
Great. That item is out, and we are going to lift the call on Senator Kehoe's item. Secretary, please call the roll.
Anderson, DeLeon. DeLeon, aye. Dutton, Wolk. And that one's out as well.
Great. That item is out. There's 2 items left on call. If we can encourage the senators to join us for JLAC to come and vote. Thank you. We will keep the roll open for a few minutes. Thank you.